This next class is about postpartum care for mom. Now, lots of times after you have a baby, your full concentration is on baby and trying to figure baby out and trying to feed baby enough and change enough wet diapers and which side did I nurse on last and all of the things. But if you don't pay attention to your own self and take care of your own self, you can't take care of baby. So both of you are important. It's a lot, I know, but you can do it. I believe in you. So the most important thing here is so that you have help around you. So you're not doing laundry and you're not washing dishes and you're not making a meal for the house, right? Somebody else is doing all those things for you so that you can take care of yourself and your baby, right? All right, I don't need this right now. Let's go here. All right, does your body change a little bit?
Yeah.
When you get pregnant and then after you have baby, body is a little bit different. All right, so after you have a baby, your vaginal bleeding is going to be heavier right after delivery, and then it tapers off to a light period. But like I said before, do not be alarmed when you go to take a shower and it is just pouring out of you. It's all right. Just if you need a little help, call that nurse. She'll come. That's what she does for you. And in my experience, they have been absolutely amazing. They are not taken aback at all by you and your nakedness or anything. They are there to help, and they get down and dirty, and they are the most wonderful people. So you let them help you. You need it. Within about 2 weeks, it's down to a few drops, depending on your situation. If you have stitches, those will dissolve within 1 to 2 weeks, and they may itch as they heal. This is when Dermaplast is your friend. So Dermaplast is that spray that they will give you at the hospital, and you can buy it over the counter. So if you need it after your can runs out that you brought home from the hospital, you can always get it from Walgreens or CVS or Kroger or wherever. But you spray that down there and it helps to numb the area. So number one, when you have pain after you have a baby, it will be much easier to heal or just to survive. And then also when it's itching, spray that on there and it will help that, because you don't want to be messing with that area. You want it to just heal on its own without touching it. So do not use tampons for 6 weeks or until approved by your doctor. Contact your doctor if your vaginal discharge is foul smelling, if you're saturating one sanitary pad within 2 hours, or you're passing large blood clots. All right? That's pretty self-explanatory. Urinary discomfort and leakage. Recommended, don't wipe with toilet paper unless you have to. It's very painful and it can get infected. Yeah. So instead, we're going to use a peri bottle. You fill it up with warm water, and then after you use the restroom, sitting on the toilet, you're just going to squeeze it all over you. Okay? You may need to fill it twice. It's perfectly fine. Just squeeze, squeeze, squeeze until you feel like you are clean, and then just dab it a little bit. You're going to be sitting on the toilet for a little bit, because then you got to fix all of your pad and put all the things in there. There's Tux pads, which are amazing, and then you got to use the Dermaplast and on and on. So this is when you need to go to the restroom, you need 8 or 9 minutes. Okay, so just prepare that time for yourself so that you're not rushed and you can really make sure you're taking care of all of your needs. You may lean forward urinating so it doesn't run backwards and burn. I wish I had that tip when I had babies. I never did that, but it's a great idea. You may leak some urine when you laugh or cough due to stress incontinence. That's okay. What are we going to do to mitigate that, Cheyenne?
Kegel exercise.
We are going to Kegel. We are going to strengthen those muscles again, and it may take a while, but with persistence, you will get it, I promise. Doing pelvic exercises, once able to do so comfortably, will help strengthen these muscles. Super important. Uterus cramps. They're called afterbirth pains. is the process of pregnant uterus returning to its pre-pregnancy state. It takes about 6 weeks for it to get all the way back down. And when you breastfeed, you may cramp more. It signals your uterus to close down. If you don't breastfeed, you may have a little cramp now and then. You can take Tylenol or you can use warm packs. Any questions so far? Okay. It's our favorite subject. Constipation and hemorrhoids. Avoid straining with a bowel movement. What is the best way to not get into a moment where you are having to strain to have a bowel
Take a
movement?
laxative.
Okay, or
Drink water.
drink a lot of water, or what else helps with the bowel movement?
Walking?
Yes, exercises and the kind of food that you eat.
Yes.
Making sure you're eating roughage, so an orange, something with a lot of fibers in it. Celery, something with a lot of fibers in it. All right, so those are really healthy things for your gut, and your gut is going to thank you by consistently emptying out. So you want to empty out several times a day to keep from straining. Straining is the last thing you want to do after you have a baby. All right, drink plenty of water so your stools are soft. Eat high fibrous foods. Take a laxative if you become constipated. Walk a few minutes each day. Tuck pads or cotton balls with witch hazel can help relieve hemorrhoids. Hemorrhoids. It's just because a lot of pressure is going down south as you push baby out. It's completely normal. It's nothing to be super scared about because there are lots of ways to help make that get better.
They go away.
Sometimes.
No, don't say that.
You can live with the hemorrhoid? Just
Oh yeah. Oh
That's
yeah.
horrible. That sounds terrifying.
No,
Right.
there are lots of worse things in life.
I
A lot of worse
I
things
have
in
to
life.
be one of the worst.
It's really okay. You know, lots of people who lift really heavy and squat really heavy end up with hemorrhoids. So there's a lot of reasons why somebody would end up with a hemorrhoid. You'd be surprised. I'm surprised at how skittish you guys are about hemorrhoids. I'm really surprised about it because it's super normal. Okay, cesarean section, or also called C-section. It may take a little longer to heal. It will. It will take a little longer to heal. Likely you'll have stronger pain medication because you'll have this big incision in your belly. You can't drive or lift anything heavier than your baby for 6 weeks. However, it's pretty amazing how quickly the body will repair itself. That uterus will go all the way back down, just like if you were to have a vaginal delivery. And so it's back down to its original size 6 weeks later. Backache. Your center of gravity has changed from supporting your heavy uterus and hormonal change. It takes time to return to normal posture and regain your balance. Tylenol may help ease back pain, and a supportive brace or compression underwear may help. What else could help mitigate your back pain because your belly was going here and now you need it to go here?
I was a waist trainer.
Okay, so that's similar to a supportive brace, a waist trainer. Something else. Abdominal crunches, work, getting stronger. So it's not suggested that you do any huge physical activity like exercising until your 6 weeks checkup and they give you a release. But what's keeping you from tightening your abdominals? Nothing, right? Think about just tightening your abdominals. When you're just standing there, just tighten them. That's not sucking in, that's just tightening your abdominals. Every time you do that, it's teaching your abdominals to be stronger, and it's bringing more support to your back. So your strong abdominals bring support to your back. So that's also going to help you. All right, breast discomfort and leaks. Heavy, full breasts and nipple tenderness is common, especially in the first 6 weeks when lactation is establishing. Warm and cold compresses on breasts before or after breastfeeding can help. Pain or bleeding and cracked nipples is a sign that your baby may not be attaching well to the breast. If you choose to formula feed or need to stop breastfeeding abruptly, breasts may become full and feel uncomfortable. Wear a supportive bra and only express what you need to for discomfort until milk supply decreases. When you breastfeed, baby tells you how much milk to produce. So the more baby nurses, the more milk your body will make. The less baby nurses, the less milk you will make. So if you nurse and then at the next feeding, baby takes a bottle, your body is going, oh, okay, we need to make less milk because baby is not going to be needing as much. And then you nurse baby again, and the body is constantly going back and forth and figuring out how much baby needs. It's super important at the beginning to not supplement. If you want to breastfeed, that's what you do. You breastfeed every single time. Personally, I never supplemented any of my babies. For that first year, baby went with me everywhere I went. And if I couldn't take baby, I didn't go. It's okay. It's really okay because I only get this time with this baby once. And then it's gone forever and I can go anywhere I want to now. It's worth it. To me, it was worth it. Everybody is a mom differently, and you can choose however you want to feed your baby as long as you're feeding your baby. Super important. Best for baby is your breast milk. When baby is suckling, there is an exchange that goes into your areola, and your body actually knows how to make the antibodies and send the antibodies to the baby that the baby needs for that moment. It is pretty miraculous on many different levels, breastfeeding. So, and like I said, you can be as passionate or impassionate about it as you want to be. There's no one right way, but there is a right way for each mama. So you guys do all the research you need to, figure it out, and stay dedicated to it. You may leak breast milk as the breast becomes fuller. You can wear disposable breast pads in your bra. It's a have to. You gotta put those breast pads in there because there will be some leakage. All right, that's okay. It was totally worth it for me. The number of times I was horribly embarrassed, it's all right. I'd do it again in a heartbeat. It's kind of funny now. All right, body temperature variation. Changing between feeling too warm or too cold is very common. This is due to hormonal changes. And there's going to be lots of hormonal changes constantly happening in your body after you have this baby. All right? So just kind of goes with it. All right, tips to care for yourself. Let's care for ourselves. Ladies, physical care. Try not to do too much too soon, like I was talking about before. Dishes are not your duty after you have a baby. Focus on getting to know your new baby and allowing your body to rest and recover. Try to rest and sleep when your baby sleeps. Eating healthy, nourishing food and drinking plenty of water. Avoid skipping meals. You need those calories, especially if you're breastfeeding. Aim to go for a gentle walk each day or do some other low-impact exercise, starting with a 5-minute walk around your home. When I had my first baby, I found myself feeling very sad a lot, just kind of hopeless. And I was talking to my mom on the phone one day, and I was crying, and she said, Karen, when was the last time you left the house? And it had been maybe 10 or 12 days. She said, put that baby in a stroller and you get outside. And it made all the difference. And after that, every single day, I made sure we got outside the house. Just go. Change up the scenery. Baby needs it. You need it. It will be a refreshing time for you both. All right, pelvic floor, a group of muscles which supports your bladder, uterus, and bowel. They all get stretched during pregnancy to allow baby to be born. A strong pelvic floor helps maintain good bladder and bowel control so you don't leak urine when you laugh or cough. Super miserable to leak urine when you laugh or cough. So please make sure that you are doing those pelvic floor exercises. So how to feel your pelvic floor. Sit or lie down with your thighs, buttocks, and stomach muscles relaxed. You want to practice it right now? Just relax. Squeeze the muscles around your anus, your back passage, as if you're trying to stop a toot. Squeeze and relax these muscles a few times to get used to the sensation. See what it feels like. Then make sure your buttocks remains relaxed and that you are breathing normally. So you squeeze, and then you release it. And then you squeeze, and then you release it. It's not something somebody else is going to see, right? You can do this without anybody else seeing it, but you know what's happening. Squeeze your pelvic floor muscles. You should feel the muscles around your anus and vagina lift up inside. Hold them as tightly as you can while counting to 8, or as long as you can. Then relax your muscles. You should feel them let go and relax and rest for around 8 seconds. Repeat the exercise as many times as you can. Another great way to do this is when you sit down to urinate. And as the flow starts to come, stop it. And then release it again, and then stop it. And then release it again, and then stop it. At first, after having a baby, you might not be successful stopping that flow. But keep trying, because you'll figure it out. It'll get there. Every time you try to stop the flow, you're strengthening those muscles. All right, so just keep on, keep on, keep on. And all of a sudden you'll go, I did it. Look at there, I did it. So keep on practicing. Don't give up. You're going to sit down to go pee anyway, right? So just make sure that you add in those extra steps to help take care of yourself. It can be helpful to link them with a regular activity, looking on your phone, waiting for the microwave, standing in a queue, or sitting at red traffic light. Any time when you are relaxed and can focus on strengthening your pelvic floor. Remember to actively squeeze your pelvic floor when you cough, sneeze, or lift heavy objects. This will help you strengthen your pelvic floor and to reduce the chance of urine leaks. Emotional health. It's a big deal. Baby blues. Have you heard of that? A lot of people, up to 80% of women experience mood swings or intense emotions caused by changes in hormones. You may feel unexplained crying, irritability, insomnia, sadness, mood changes, and restlessness. Sounds like being pregnant, right? So a lot of those same feelings, but almost like you feel guilty feeling those feelings because you have this beautiful baby with you. So, but it's normal. It's normal to have these baby blue feelings. Postpartum depression is very different than baby blues, all right? Postpartum depression is much more serious, and you need to take it more seriously as well. Paying attention to the guidelines, like feeling low or not feeling anything, just being numb. Feeling hopeless or worthless, which you have to recognize is a lie, right? That's that negativity coming in and settling in your brain. If you're feeling worthless, you got to fix that with truth. Difficulty coping with daily activities. Losing interest in others, including your new baby. So it's almost like a turning inward and being numb to everything outside you, even your new baby. You're sleeping too much, or you're having difficulty sleeping, one or the other. Changes in appetite together with weight loss or weight gain. Thoughts of harming yourself or your child. And I'm sure you know that last point is super extreme. So by the time you get here, you have negated these other feelings. Yeah, I'm having that feeling, but it's no big deal. Yeah, I'm having that feeling, but it's no big deal. And then it's built up and built up and built up, and now you're here. Okay, we want to stay far, far, far away from here. We want to keep our mental and psychological well-being so important that we catch it immediately. When you're just feeling low or feeling numb, or you're feeling hopeless or worthless. So I don't know if you know this, but you were created with a purpose, a specific design. You, yourself. And there is nothing worthless about any person on the face of the earth. Because I believe that you were created by the hand of God, and that no life, even the one inside your womb, as we speak right now, is worthless. We are full of worth, and God intentionally has brought life into ourselves, all right? So that in itself, you know, you can push those things away. When you've got a standard of truth, you can push those lies away. So if you start to feel like this, say something, speak out. You've got resources upon resources upon resources here. You've got people who love you. So please, please, please reach out, and we will be here to help you. All right, that's what this whole next slide says. If you're struggling, ask for help. This is common. Do not feel ashamed if you feel like that at all. We are here to help you. So also make some time for yourself each day, doing something you like and that gives space for you. It takes time to recover from pregnancy, labor, and childbirth, and it's important you don't expect yourself to just bounce back. Be patient as your body heals and you adjust to your new life with the baby, because it is a new life for you. All right, postpartum kit ideas, heavy-duty pads, peri bottle. Bring it with you everywhere you go. You need it after you have that baby. An inflatable donut, just in case you got stitches down there, and it will be much more comfortable to sit on. A stool softener, witch hazel pads, the Tucks. You can just buy those at any, like Walgreens or something. Advil or Tylenol. Aleve is not generally recommended, or whatever prescription your physician has given to you. Some cheap cotton panties. If you can, just clean out that little cabinet that they give to you, several different pairs of neck panties. So grab those because they're amazing. Ice packs, sitz baths, lanolin oil, heating pad, nursing bras, nursing pads for leak, huge. Nipple cream, huge. You gotta have something to put on those nipples because baby is going to be sucking hard. Baby's hungry. All right. Any questions? It's so much, but that's why I like this little part. So I'm gonna ask the questions and you're gonna answer. How long should you bleed heavily after having a baby?
2 weeks.
2 weeks. And in keeping an eye on your discharge, when is it time to call your physician? Something ain't right.
When it has a smell or a weird color.
Yep. What should you use to clean yourself instead of toilet paper?
The peri bottle.
Good. And what can you do to strengthen pelvic muscles and help reduce incontinence?
Kegels?
Who said it? Shauna. You can Kegel. And when can you do this?
Anytime.
Anytime. But nobody else knows. What are contractions called that occur during the healing process? It was mentioned one time.
Afterbirth contractions.
Close. Gonna give it to you. Afterbirth pains.
Oh.
Yeah, but same thing. How long does it take for your uterus to return to normal size?
6 weeks.
Good. And then we're just going to start naming some strategies. Which one did you want?
This is fine.
Okay. So start naming some strategies to help with hemorrhoids, our favorite subject.
A sits back.
Not straining.
Not straining. What else?
Exercise.
Exercise does. It helps blood flow and stuff like that.
Ice packs.
Yes? What's that spray called? Dermoplast.
To prevent hemorrhoids.
To prevent or help ease the pain.
Laxative.
Yes. And also, if you're sitting straight down on them, all that pressure is going down. So it might help to sit on your side, lay on your side, take the pressure off of them, help them relax a little bit. Okay, what are some have-tos when breastfeeding? Like super important.
You have to eat. Like, you can't skip any meals.
You have to eat your calories, yep.
Uh,
Y'all are doing awesome.
Drink water. And
Drink-
take your prenatals.
Drink lots of water, take your prenatals. What other ones did we mention today?
nipple cream.
Yes.
Disposable pads.
Yes.
A nursing bra.
Oh, yeah, nursing bras.
Oh, yes. We didn't say that already. I have one left. I'm going to save it. Also, when you're breastfeeding, if you have a lot of cracking and bleeding and bruising and stuff like that, that might be a sign of?
The baby isn't latching
The
correctly.
baby isn't latching correctly. Perfect. So you can always get a lactation consultant at the hospital. They are at your disposal. Please, please call them. Have them come up. They are going to actually look at the baby, watch the baby as the baby opens his mouth and latches on, and they can help you with different positions, show you exactly what's going on. They're going to go, oh, no, he's not nursing right. We need to turn him over here. All right, so what is the best avenue to caring for yourself and healing well? There's lots of things.
Getting out of the house.
Yes? Take a little break.
Not
Change
stressing
the
yourself
scenery.
out over things.
Yes, like what things?
Chores.
Yes, like housework, making dinner, cleaning toilets, things like that. Something else, super important. When baby's taking a nap, what do you do?
I'll just sleep when the baby sleeps.
You sleep. Now, I would just say rest, but I gotta tell you, sitting down and putting my feet up, I'm resting, but sleep is like taking rest to another level. So if you can sleep, your body can really relax and that healing process can really take over. Good. So you're gonna eat healthy food, you're gonna drink lots of water, and you're gonna let other people help you. Okay, what are some symptoms of baby blues? Of baby blues now.
Being inconsolable. Like you can't stop crying.
Unexplained crying, yes.
Mood swings. Irritability.
Yes, irritability. Where you just feel,
Hopeless.
Depressed.
you just feel sad, you have lots of mood changes, you're kind of restless. And something else, something that I just said that you need to have and you can't get it.
Help.
No. You need to have it to heal, but for some
Exercise?
reason you can't get it. You want it real bad, and you set yourself up for success, but it's just not coming to you.
Yeah. I don't know. I'm confused. Sleep. Rest.
Sleep.
Yeah.
When you can't sleep, what is that called?
Insomnia.
Insomnia. Oh, that's awful. So we're going to try to mitigate insomnia with lots of different things. We're not going to take sleeping pills, right? We're going to do other things. We're going to stretch a little bit, some relaxation techniques, some breathing, maybe a sound machine will help us, other things like that. And if it's intense, you're going to call your practitioner. Symptoms of postpartum depression.
Wanting to harm yourself, your baby.
That was the most intense one. That was the last one, remember? Yeah, we do not want to get there. So what were those other things at the very top, like the first things?
Feeling detached.
Okay. Like not being interested in
Being
connecting.
present.
Losing
Yeah.
interest in things.
And something else with I talked a lot about it today.
Feeling like you're not worthy.
Feel, yes, thoughts that you're not worthy, hopelessness, things like that. Yes, those are some times where you should stop, recognize, and reach out for help at those very first thoughts, okay? You need somebody, sometimes it's hard to speak the truth to yourself and you need a friend to speak it into you. Even though you've heard the truth before, you just need a reminder. You need somebody to partner with you and believe for that same thing in your life, all right? All right, let's talk about that postpartum kit. What are some things in that postpartum kit that are super important?
Pads.
Yes, gotta have them.
Berry bottle.
Yes, take it with you.
Breast pads.
Yes, take it with you.
Cream.
Nipple cream.
Yes, take it with you everywhere you go.
Disposable underwear.
Yes, something that's okay if you throw it away. Because if you make a mess, you're not gonna wanna save it. Just throw it away.
The spray was called Derma.
Thermoplast. Yep. So after I had a baby and we had to go places, I would have a bag in my in the diaper bag that had all of those things in it. And so I would just reach in the diaper bag, grab that bag, and take it to the bathroom with myself. So you have all your stuff right there with you everywhere you go. So it's good planning, and it makes for a much easier time while you're out. You have all the things that you need right there with you. All right?